Welcome back to the deep dive. Today, you've handed us this just a remarkable collection of source material,
It really is. We have class notes, full audio transcriptions, slides.
and it all traces this incredible chronological history of public health. I mean, this is just a list of dates and names.
No, not at all. It feels more like, the architectural blueprint for modern wellness.
That's a great way to put it. We're literally tracing humanity's understanding of health from thousands of years ago when, like, the best medicine you had was a well-built ditch.
Right, all the way up to today, where we're battling chronic diseases and, these massive global health disparities.
So our mission today is to really pull out those key architectural elements, the big aha moments,
Yeah.
the people who really built the framework of community health as we know it.
And it is a huge sweep of time, so we have to stay focused.
We do. And as we unpack all this, I think we need to keep coming back to three things that they show up in every single era.
Okay.
First, the management of water. Second, the removal of waste.
The fundamentals.
The absolute fundamentals. And third, the revolutionary use of data. Those three things are, I think, what really drive this story forward.
What's so fascinating to me looking through all of this is seeing how often that physical infrastructure, managing the environment, came way before any real medical understanding.
Yes. For thousands of years, the best solutions for preventing disease were basically civil engineering projects.
Long, long before they were pharmaceutical or molecular.
Okay, so let's unpack this. This is essentially the story of how human ingenuity, really just driven by survival, codified the rules for living together.
Without, killing each other through contagion.
Exactly.
Yeah.
And to do that, we have to start right at the very beginning, the dawn of civilization.
Right, so we're starting before 500 BC. In what they call the cradle of civilization, where the first steps toward any kind of public health weren't about medicine at all.
No, they were about logistics.
Pure logistics and organization. These early civilizations, they figured out really fast that if you want to have a large population, you have to manage the environment.
And on a massive scale. The source material just keeps coming back to these huge infrastructure projects.
And it's all about water. Managing water for survival and for farming.
You look at places like Babylon or, ancient Egypt, their big contribution was creating these really sophisticated water and irrigation systems.
The immediate goal was just better
Mhm.
crops, right?
Of course. More water means a more reliable food supply, and that translates directly to better nutrition for the whole community. You're more resilient.
But here's the insight that I think is so important, and the sources point to it. Even though they had no idea what a germ was,
Not clear.
these systems were naturally keeping their water sources cleaner. By channeling rivers and managing that flow, they weren't relying on, stagnant pools or polluted local water.
They were practicing public health by accident, just by managing their environment better.
Exactly. Then you shift a little bit over to the Minoan civilization on Crete.
And it took it a step further.
A huge step further. Crete pioneered actual plumbing, but specifically for sanitation.
So this isn't about drinking water for crops.
No. This is about the direct, large-scale removal of wastewater and, critically, human waste, getting it out of the city centers.
And that distinction is it's huge. I mean, if you are physically moving human waste away from where people live and cook and get their water,
You immediately cut down on so many problems.
you reduce the spread of disease, you improve sanitary conditions. It's a physical intervention with massive, observable public health consequences. It's the absolute foundation.
And beyond just the engineering side of things, they also started setting up systems for patient care.
And accountability, that's a big one,
A huge one. This is where you get the famous Code of Hammurabi from Mesopotamia.
which dates back to, around 1754 BC.
Something like that. And it was one of the very first systems for legal accountability for physicians or, the healers of the time.
The idea that a professional who heals you should be governed by a set of written rules, that was revolutionary.
But it was a really harsh system. And the details in the source material really show the kind of social disparities that were just baked into their approach.
Right. The penalties were incredibly clear and incredibly harsh. If a physician messed up, especially on a high-status person, they could face.
Well, they could lose their hand or even their life.
But the flip side of that fear was the economic part. The sources note how payment was completely stratified based on the patient.
Totally. If you successfully treated a wealthy person, you got paid way more silver than if you treated a slave.
So the value of the patient determined the consequences and the rewards for the doctor.
Exactly. And the consequence of that isn't just, unfair pay. It arguably creates a two-tiered system of care where the quality is legally tied to the patient's wealth.
It's a stark preview of the access issues we still talk about today.
Absolutely. And they started writing things down. We see evidence of prescriptions on papyrus, on clay tablets.
These weren't, modern drugs, of course.
No, no. But they were documented herbal remedies, explicit medical guidance written down to preserve what worked. That shift from just oral tradition to a written record is so key.
And we can't forget the role of religious texts in all this. The book of Leviticus, for example, it formalized so many hygiene practices.
They were basically public health rules wrapped in theological instruction.
And that codification, it enforces a kind of communal responsibility. It had detailed rules for, say, women during menstruation.
Right, acknowledging the need for separation during certain biological processes.
And critically, it had really strict protocols for how you were supposed to remove dead bodies from the community.
Which were all designed to stop the spread of something they couldn't see, an unseen contagion.
It's a system of social regulation for group survival. If everyone follows the rules, even if the reason is divine instead of microbial, the public health outcome is still positive.
It's just amazing how much of it was just survival instincts written down and enforced. Manage the water, move the filth, watch who gets sick.
So as we move into the classical times, say from 500 BC to 500 AD, there's this huge shift, especially from the Greeks.
A monumental shift, yeah.
Uh,
We're moving away from just pure infrastructure and into intellectual observation.
and this is where Hippocrates comes in, the father of medicine.
His core insight was this revolutionary pivot away from explaining illness as purely spiritual or supernatural.
Right. It wasn't just the wrath of the gods anymore. There had to be another reason.
He shifted the whole focus toward natural, empirical explanations. This is really the birth of environmental determinism in health. He was all about observation.
Watching for patterns.
Exactly. Patterns related to the environment, to diet, to water quality. He'd noticed, for example, that certain sicknesses only seem to appear during the rainy season or in swampy areas.
It was basically the first step toward epidemiology. He was looking at the place and the time where illnesses were clustering.
He was telling people to look at the air they breathed, the water they drank, the physical location of their town to understand disease. That empirical approach. It's the root of the clinical observation we still use.
And the Greeks also had this huge emphasis on physical health, what we now call preventative medicine.
Oh, totally. All the physical education, the gymnasiums, they clearly understood that the body needed constant maintenance, not just repair when it broke.
So while the Greeks are focused on theory and observation, the Romans are, well, they're the Romans.
Right. They were less about the theoretical breakthroughs and way more about grand engineering and urban health.
And it was driven by pure necessity. If your soldiers and your citizens are sick, your entire empire collapses.
The aqueducts are the perfect example. I mean, the scale of that engineering was just unprecedented, bringing huge amounts of clean water directly into a city like Rome from pristine sources miles away.
And all that water allowed for two really key developments that changed city life forever.
The first one is obvious: the public baths. An early attempt to promote hygiene, a communal space for washing.
But there's a real contradiction there, isn't there? The idea was hygiene, but by our standards, they could be incredibly unsanitary.
Oh, for sure. You have thousands of people sharing the same water in really close quarters. So the intention was sanitation, but the mechanism for spreading disease was probably working overtime.
It just shows you the limits of public health before you understand germ theory. They could manage the environment, bring in clean water, but they couldn't understand contamination.
But they also massively expanded on the plumbing and sewer systems. That whole practice of removing human waste, the cloaca maxima.
Right. And all of this culminates in the development of the hospital, formalized hospitals.
And the source material highlights this really crucial dual origin story for institutional care.
Yeah, the motives couldn't be more different. On one hand, you have the Roman military hospitals,
Which were purely strategic. They were built to treat injured soldiers and sick slaves so they could get back to the battlefield or back to work as quickly as possible.
The motive was military and economic efficiency. It was a strategic asset, not philanthropy.
And you contrast that with the hospitals that were being developed by early Christian charities.
Completely different. These were founded on altruism, aimed at caring for orphans, widows, the poor. people who had no immediate value to the state.
And the existence of both just shows that institutional care grew from both pragmatic and altruistic roots. Before this, most care happened in the home. This shift to housing the sick communally was a huge structural change.
It's an amazing transition. From Hippocrates giving us the idea to look at the environment to the Romans giving us the infrastructure to survive in it.
But all of that momentum, it's about to hit a very, very big wall.
Yeah, we're heading into the Middle Ages, or the spiritual era,
Mhm.
roughly 500 AD to 1500 AD. And it's like all that intellectual progress in the classical period just evaporates.
It's a profound regression, yeah. The whole mindset shifted. Illness was now seen as being caused and cured primarily by spiritual means.
So what drove that? I mean, we had Hippocrates' observation, Roman organization. Why did they just abandon all that?
It was a convergence of factors, but with the rise of institutionalized Christianity, the focus shifted. Suffering became a test from God or a consequence of sin.
So if sickness is a spiritual trial, then treating the environment doesn't really matter.
Exactly. It becomes less important than prayer or penitence. A lot of those practical Greek and Roman texts were just lost or ignored or seen as irrelevant compared to theology.
And the consequence of abandoning that observational approach was, well, it was devastating for public health.
With no rational understanding of disease transmission and the Roman infrastructure falling apart, epidemics just flourished in these awful sanitary conditions.
And the worst example, of course, is the plague, the Black Death.
It came in waves. You had the Justinian plague back in 543 CE, and then the one everyone knows about, the Black Death, starting in 1348.
And the mortality rate was
Yeah.
it's astronomical. The source material notes that in some areas, only 1 in 10 people survive.
1 in 10. Just try to imagine the psychological and social collapse of a society with a 90% death rate.
It's not just a high death toll.
Yeah.
It's a total population wipeout that reshaped the entire structure of Europe for centuries.
The labor force was gone, trade collapsed. It was apocalyptic.
And that catastrophe, that sheer scale of death, eventually forced a return to observation, even if it was just out of pure desperation.
Right. So by the time we get to the Renaissance and the Age of Exploration, say 1500 to 1700, we're still dealing with epidemics, but you start to see an intellectual shift.
A slow, painful move away from the purely spiritual explanations. It's like a revival of Hippocratic thought.
People started looking at the environment again. They started noticing patterns, clusters of illness in certain towns or on certain ships.
But the Renaissance also brought this massive new global threat.
Disease spread, yeah.
Yeah.
With all the exploration and trade, the world got a lot smaller very quickly.
And the sources really highlight the tragic side of that. European colonists carrying diseases like smallpox and measles.
Diseases that were endemic in Europe, but manageable.
Right. They brought them to indigenous populations in the Americas who had zero natural immunity.
And the result was a demographic catastrophe. Population wipeouts. Some estimates say 90% of certain indigenous populations were killed by these diseases.
It's this profound lesson that while interconnection is great for trade, it dramatically increases the speed and scale of public health crises.
So after this 1,000-year detour into theology, humanity finally starts to realize again that the environment, that geography, it matters.
And that realization is what sets the stage for the real scientific revelation.
Absolutely. We're entering the 18th and 19th centuries now, and this is where the ancient problem of waste and water finally meets modern scientific discovery.
The late 1700s, you have the Industrial Revolution just exploding, and with it comes this immediate, massive public health crisis.
People flooding into cities. London, Manchester, New York, you get severe overcrowding in tenements, rapid disease spread.
And sanitation problems on a scale nobody had ever seen before. Factory pollution choking the air, industrial waste pouring into rivers, human waste piling up in the streets.
It was the perfect storm, a perfect breeding ground for disease.
And what do you need to manage a population crisis like that?
Data.
Data. The sources point out that the first U.S. Census was crucial, not just for government, but for public health.
Because you could finally map where people were. Population density, location. It's the foundation of epidemiology. You have to know who is where before you can figure out what's killing them.
And before we even get to germ theory, we get this huge moment in prevention. Dr. Edward Jenner, 1796.
The smallpox vaccine, a total game changer.
And his discovery was pure observation, just like Hippocrates. He noticed that milkmaids who got cowpox, a similar but much milder disease from cows, seemed to be immune to the deadly human smallpox.
So he took material from a cowpox lesion and inoculated a healthy person.
And it worked. It protected them from smallpox. This established the fundamental concept of vaccination. The goal wasn't just to treat illness anymore, it was to systematically prevent it on a population-wide scale.
So then the 19th century comes along and starts to formalize this whole response. And a lot of people point to one key document as the start of the modern era of healthcare.
Shattuck's report. In Massachusetts, 1850.
This wasn't just another report, it was the blueprint for state and local public health structures in the U.S. It was incredibly radical for its time.
Because it was demanding government intervention in people's lives for the common good.
Exactly. He specifically recommended establishing local and state health departments with mandatory record-keeping.
Formalized food inspection systems.
And introducing specialized roles like school nurses and programs for occupational health.
The whole focus was sanitation. He understood that managing the environment, the water, the waste, was the absolute prerequisite for managing disease. The report gave cities the framework they needed to finally cope with the industrial crisis.
And almost immediately after Shattuck provides the blueprint, John Snow provides the definitive proof that it works.
1854, the London cholera outbreak.
Yeah.
And Snow, the father of epidemiology, he doesn't rely on the old theories about bad air. He relies on data.
He meticulously mapped the distribution of cholera cases across a London neighborhood. He literally went door to door, documenting every single case, every death.
And this is where his genius comes in. He saw a tight cluster of cases, all centered around one specific public water source.
The Broad Street water pump.
Right. And he hypothesized that the source of the disease wasn't bad air. It was contaminated water from that specific pump.
So he convinced the local officials to do something incredibly simple.
Remove the handle from the pump.
And the outbreak just stopped. It immediately resolved. That one action validated his entire method.
It proved that mapping and data collection could pinpoint the cause of an epidemic and tell you exactly how to intervene. It changed everything.
And all of this observational work just laid the perfect groundwork for the biggest scientific shift of the era, the germ theory triumvirate.
Finally explaining why all the sanitation stuff actually worked.
Starting with Louis Pasteur in France around 1862.
His big breakthrough was finally ending the theory of spontaneous generation.
That old idea that life, like maggots or disease, just sort of springs from nothing out of decaying matter. He proved that unseen living organisms, microbes, were responsible for decay and disease.
Through his famous swan neck flask experiment.
A brilliant experiment. He sterilized broth in flasks. Some had these long, curved necks that let air in but trapped airborne dust and microbes in the bends.
And those flasks stayed sterile.
Indefinitely. But as soon as he broke the neck, letting the dust reach the broth, it's spoiled. He proved germs exist, they're in the air, they're transmissible. The implications for everything were revolutionary.
Then you have Robert Koch in Germany, who takes Pasteur's general germs exist theory and gives it the specificity we needed.
Koch is the one who identified that particular microbes cause specific diseases. He proved, for example, that a specific bacterium caused tuberculosis and another one caused cholera.
So he takes it from something unseen causes sickness to this specific organism causes that specific disease.
And that distinction is massive. It kicks off the bacteriological period of public health. Because once you know the specific agent, you can develop targeted antibiotics or vaccines. The door to modern medicine just flew open.
But even with all this scientific progress, social change was struggling to keep up, especially in these unregulated factories.
Which brings us to Upton Sinclair's The Jungle in 1906, an absolute bombshell of a book.
The excerpt in the source material it's just horrific, but you have to read it to understand the urgency of the time. The filth in the Chicago meatpacking district was unbelievable.
Meat falling on the floor, covered in dirt and spit, leaky roofs dripping water onto the meat, rats everywhere.
And the worst part, the workers would sweep dried rat dung off the piles of meat, and they'd put out poisoned bread for the rats.
And the dead rats, the poisoned bread, and the meat would all go into the hoppers together for sausage.
The public outcry wasn't really about the poor immigrant workers, was it?
Not really. It was outrage and fear over what they themselves were eating.
And that fear led directly to legislative change. The implementation of pasteurization and federal meat inspection. It's a classic case of social advocacy forcing public health policy.
Exactly. And alongside that, you get more advocacy for things like occupational and school nurses, and for the immigrants living and working in these awful conditions. The focus was finally returning to the environment of the factory and the home.
So as the 19th century closes out, the focus shifts again from pure science back to applying all this new knowledge. And this is where the nursing pioneers come in and just define the modern role of public health.
Florence Nightingale, she's seen as the mother of professional nursing, but her contribution to public health and epidemiology is, I think, even bigger.
Her most famous work was during the Crimean War in the military hospitals.
The crisis she walked into was just staggering. She gets to this hospital built for 1,700 patients, and there are almost 4,000 men crammed in there.
With beds only 18 inches apart. Just a perfect storm for contagion.
And she realized that the death rate, which was a horrifying 42%, wasn't mainly from battle wounds. The vast majority of deaths were from preventable diseases, cholera, typhus, dysentery, that were just running rampant in the filthy conditions.
So here's where she makes her big statistical contribution. She knew just complaining wasn't enough. She needed data.
So she invented the coxcomb chart, the Nightingale Rose. It's a brilliant piece of data visualization to show the actual causes of death.
It had different colored wedges. A small red wedge for deaths from war wounds.
That tiny sliver.
And then this huge, overwhelming blue wedge representing preventable deaths from disease. And a small black wedge for other causes.
And by visually showing that soldiers were dying from preventable disease, not from Russian bullets, she used that data to push for massive reform.
Her whole focus was on what she called the environmental determinants of health. Fresh air, fresh water, sunlight, cleanliness, sanitation.
And the results were just astonishing. She took the mortality rate from that initial 42% all the way down to 2%.
2%. She proved that systemic sanitation and managing the environment were just as powerful, if not more powerful, than medicine in saving lives.
She basically took Hippocrates' idea about the environment and combined it with John Snow's data-driven approach and just changed institutional care forever.
So then you come across the Atlantic, and you have another critical figure, Lillian Wald, who's focused on the urban crisis.
And the source material credits her with coining the term public health nurse.
She founded the Henry Street Settlement in 1893 on the Lower East Side of New York. And it wasn't just a nursing station.
No, it became a headquarters for social and civic change, because she understood that you can't practice nursing in a vacuum.
She was a fierce social reformer, a suffragette, and her core philosophy was that poverty wasn't an individual's fault. It was a deep social problem that needed structural change.
She argued you can't treat someone's sickness and then send them right back into a filthy, dangerous home and expect them to get better.
So her work was about improving the entire environment, the workplace, the home, the school for poor and immigrant families, home visits, maternal health, fighting for policy changes.
There's that quote from her. Nursing is love in action, and there is no finer manifestation of it than the care of the poor and disabled in their own homes.
It just elevates the role of the nurse to this level of active social advocacy.
And finally, we have to talk about Mary Breckinridge, who took these same principles but applied them to a completely different and very challenging setting.
The rural setting. She was focused on geography and access.
Yeah, a huge contrast to Wald's dense urban focus. Breckinridge was working in the underserved, remote mountains of eastern Kentucky. The challenge there wasn't density, it was distance and isolation.
And her primary concern was the terrible maternal and infant health outcomes in those remote areas. So in 1925, she started the Frontier Nursing Services.
And her critical achievement was creating the very first U.S. training program for midwives. She knew the healthcare model had to adapt to the geography.
By training local midwives, she created a sustainable local workforce that could dramatically improve mortality rates in places where doctors just couldn't or wouldn't go.
So we're into the 20th century, and the health landscape, even with all these breakthroughs, is still really challenging. In 1900, life expectancy is still less than 50 years old.
Shockingly low. And the leading cause of death is still communicable diseases, the same old enemies.
But it wasn't just infectious disease, it was nutritional. We were still dealing with major vitamin deficiencies causing things like rickets, pellagra.
Right. The sources mentioned Dr. Goldberg discovering that pellagra was caused by a niacin deficiency, common in poor communities that relied on corn. We were still figuring out basic nutrition.
Poor dental health, a total lack of pre- and postnatal care. These were huge problems. The first half of the 20th century was really about survival and stamping out the big contagions.
And the century saw these distinct phases of development. You have the reform phase from 1900 to 1920, which was fueled by people like Wald and the outrage over the jungle.
Then the Great Depression and World War II. The economic collapse meant people just couldn't afford care, which ultimately built the public pressure for things like Medicare and Medicaid decades later.
Then you get the period of social engineering in the 60s and early 70s, trying to structurally address health inequities.
But the critical transition, the one we're still in now, started around 1974, the period of health promotion.
And this reflects our success in fighting infectious disease. The fundamental shift from 1900 to today is moving from fighting communicable diseases to dealing primarily with chronic diseases.
Exactly. Today, in high-income countries, the biggest challenges are heart disease, diabetes, cancer, stroke, things that are deeply tied to lifestyle, environment, and genetics.
Which brings us to the core philosophical dilemma of the 21st century.
And the sources define it so clearly. On one hand, health decisions are, to a large degree, an individual's responsibility, the choices we make.
But, and this is the crucial part, society has an obligation to provide an environment where being healthy is actually possible and even encouraged.
And that societal obligation is exactly where you see modern health disparities. The unequal distribution of a healthy environment is our current crisis.
The sources use that Louisville, Kentucky example, the Smocktown mural area, to show this so powerfully. In certain low-income neighborhoods, life expectancy can be a decade shorter than in wealthier areas just a few miles away.
And the rates of chronic disease are through the roof.
And it's directly linked to the environment. Lack of access to healthy food deserts, no safe places to walk, more exposure to industrial pollution.
It's the ghost of John Snow's map and Chaddock's report just laid over a modern city. The infrastructure exists, but it's unequally distributed. We're failing that societal obligation.
And if you look at the global view, the disparity is even more shocking. Heart disease and stroke are the leading killers worldwide.
But low- and middle-income countries are still fighting the battles of the 1900s at the same time.
5 of the top 10 causes of death there are still communicable diseases. HIV/AIDS, TB, malaria. They're dealing with both waves of illness at once.
And the water crisis. It's a direct echo of everything we've talked about.
Yeah.
A staggering 80% of all illnesses worldwide are related to poor water and sanitation.
Let's just put some numbers on that. 35% of the global population lacks sanitation. 9 million people don't have access to clean water.
And the most tragic part is who this hits the hardest. 1 in 5 deaths in children under 5 is due to a water-related disease.
These are preventable deaths of millions of children every year, caused by basic infrastructure failures that we solved in the West 150 years ago.
And on top of that, you have hunger and malnutrition. 1 in 9 people globally are chronically malnourished.
And malnutrition is the primary cause in 35% of all deaths among children under 5. Lack of food is literally the leading killer of young children in the world.
And finally, the sources note the barriers for vulnerable groups, like refugees. Language, lack of resources, transportation, displacement just makes every single public health challenge exponentially worse.
What a journey. I mean, we've gone from Crete's plumbing and Hammurabi's laws through the spiritual blight of the Middle Ages, the game-changing data of John Snow, and the social justice work of Nightingale and Wald.
And if you connect it all, the big picture is organized infrastructure and good data collection almost always come before the big medical breakthroughs. Nightingale proved it with a chart. Snow proved it by mapping a pump.
Better ventilation and cleaner water are often the most powerful tools in public health.
Understanding this history really clarifies why sanitation, data, and social advocacy are still paramount today, whether you're fighting cholera or heart disease. The environment is always the primary determinant of a population's health.
So that brings us to the final thought for you to consider. Given that we now formally recognize society's obligation to provide an environment where good health is possible, how do we actually measure and enforce that obligation globally?
Billions of people are still facing the same basic water and sanitation issues that plagued Rome and industrial London. Where's the responsibility for that fundamental life-saving infrastructure lie now? And how do we mobilize the same kind of political will that Jenner and Nightingale did to finally solve this problem once and for all?